Hi everyone, thank you for watching this video about leukorrhgia. Leukorrhgia is a gynecological disease that involves a persistent profuse vaginal discharge. This discharge is normally called leukorrhea, and in fact, leukorrhgia is not an exact word that you can look it up in the dictionary. It is made up by people that representing the leukorrhea is now in an excessive flow. When we break down this word, the prefix leuco means white in color or colorless. On the other hand, the suffix rhagia, similar to metrorrhagia, similar to menorrhagia, rhagia always means excessive flow or a burst of a fluid. So when we look into this word, it simply means the leukorrhea, the white discharge, is in excessive flow. So normally women have leukorrhea in a normal amount, but in leukorrhea, it means that the discharge is significantly increased when compared to normal. And sometimes this discharge is come up with abnormal changes in color, quality, and odor. For leukorrhea, it is a normal mucosal discharge coming out from the lining inside the vagina. It is usually white or colorless, odorless, and usually scanty. In TCM point of view, leukorrhea is basically a kind of fluid, a kind of body fluid. So as you may all know, that fluids, it is a kind of yin. So leukorrhea is also closely related to the abundance of yin and fluid. In TCM point of view, it is regulated by a few organs and meridian. For organs, we should look into the function of spleen and kidney, which spleen is usually responsible for the transport of water and fluid, while kidney is governing the water and fluid, and it also governs the storing and sealing. For the meridian part, we should look into 任脉, 督脉, and 带脉. 任脉 is regarded as a C of yin meridian, and the insecurity of 任脉 will cause leukorrhea. Number two, 带脉 is the C of yang meridian, and the insufficiency of 督脉, meaning the yang is indeficient, will also cause leukorrhea as a water retention. When the yang qi is failing to evaporate the water, to transport the water, to transform the water. And 带脉 belt vessels acts as a constraint to control the leukorrhea discharge. As you all know that 带脉 is a special meridian, special vessels, which goes all the way horizontally around the body in the waist. It is kind of different from any other meridians or vessels coming along the trunk. For example, 任脉 and 督脉 is a vertical vessels, and the other meridian are also running vertically up or down the trunk. So 带脉 in this case, it's kind of like a constraint. It's like a rubber band controlling the qi and blood within the meridian that's passed through. So in case of the blood vessels is insecure, leukorrhea is one of the results that came out uncontrollably. And the interesting thing is 带脉, the Chinese word 带 is is meaning belt, Well, blood vessels and leukorrhea, the Chinese word about leukorrhea is 代谢. And the reason why there is such a coincidence is that ancient people thinks that the leukorrhea came from the daimai. So it's kind of a direct relationship between the blood vessels and the chorea. So apparently, when blood vessels is not controlling other meridian, not controlling other vessels, not controlling the chi or blood or fluid running within these vessels, leukorrhea is likely to happen. Normally, we have a normal amount of leukorrhea, but in leukorrhea, it means that the flow is abnormally heavy. It happened when existence of external dampness or damp heat, or if there is internal dampness caused by the dysfunction of several organs, such as spleen, kidney, renmai, dumai, and thymai. In normal cases, leukorrhea will be appear to be more than normal within the period. There is several period of time that we may expected more leukorrhea than usual. For example, during ovulation, leukorrhea is likely to be profuse and sticky. And the same thing happen before or after period. There may be more leukorrhea than usual. But when we talk about leukorrhea, it means that apart from this kind of factor, leukorrhea still having a more profuse discharge than normal. And it usually comes up with other symptoms. So the first cause and mechanism causing leukorrhea is spleen deficiency. Spleen deficiency is normally caused by improper diet, damaging the spleen, or overworking, overthinking that may overload the spleen, or it may because this restraint from liver, from the five element relationship, liver is closely related to spleen. And the excessive liver is likely to cause spleen deficiency. So when there's a spleen deficiency, spleen fails to transport the water and fluid. So there is impaired water and fluid transportation, and this may result in water retention within the CV and BV, that is the conception vessels and the blood vessels. In that case, leukorrhea is happen. The second reason is kidney deficiency. Whether there is deficient constitution or patient has sexual overindulgence or patient are giving multiple birth to babies, kidney yin or yang is likely to deplete it. So in case of kidney yin deficiency or kidney yang deficiency, depends on which the case is, it will also result in leukorrhea. In case of yang deficiency, there is coldness in renmai and daimai, causing insecurity and fluid retention. And in yin deficiency, the deficient heat will disturb the qi and blood flow within the renmai and daimai, causing the insecurity and the chaotic fluid movement. In both cases, it will result in leukorrhea. And the third reason is damp heat, which the heat is usually refers to a kind of toxic heat. In more than words, it is kind of inflammation. So whether we are after menstruation, we are in a post-menstruation period, or postpartum period after giving birth to the baby, or having a surgery. So in this case, we have an open wound, that infection is likely to happen. If there is infection, the damp heat and toxic heat will intrude the renmai and daimai. So the qi and blood flow will disturbed, or the renmai daimai will being injured, and the security of renmai and daimai will cause leukorrhgia. So when people come to your clinic with the chief complaint of leukorrhea, of profuse amount of leukorrhea, you should look into the possibility to any vaginal infection. For example, is there any improper hygiene related, or is there any improper inhygienic sexual activities? And especially when it happens after menstruation, after postpartum, after delivery, or after surgery, where there is an open wound for pathogens to invade. And the clinical symptom is a heavy leukorrhea flow with abnormality with regard to color, texture, and odor. In some cases, it may come along with pain, itchiness, or hot sensation, or dysuria. Dysuria means the pain when you pee. In modern medicine, there are several conditions that may result in a profuse leukorrhea discharge. For normal cases, uh, the leukorrhea is appeared to be odorless and in a clear or slightly milky, slightly white color, and usually there is no discomfort uh, coming up with. But in case of bacterial infection, we call it bacterial vaginosis, the odor will become unpleasant. There will be a foul, fishy, or musty odor, smell, and the discharge will appear to be milky, white, or gray, and usually increased in volume. Usually, patient will also feel itchy, or there's a burning sensation happening within the vagina. And this is caused by various type of anaerobic organisms. However, when the vagina is infected by the aerobic organisms, this is called aerobic vaginitis. And usually the odor appears not fishy anymore. It appears at a rotten smell, and the discharge is become sticky yellow or green discharge. Similar to bacterial vaginosis, the patient may also feel burning, but at the same time also stinging. Well, these two kinds are the bacterial infection causing vaginitis. But the most common type of vaginitis is candidiasis, where candidiasis is not a bacterial infection, but a fungal infection. So the fungal involved, the yeast involved is called Candida albicans. by means of albicans. Alba means white in color. So you may expect that the discharge may be white in color. And apart from the white color of the discharge, it may also appear as a thick, curdy texture, pretty much like cottage cheese. Patient with candidiasis will also may appear soreness, itchiness, or inflammation within the vagina. And this kind of inflammation is characterized by the cottage cheese-like discharge. It is no longer fluid, but it's half solid. And there another uh, parasite will cause vaginitis. This is called trichomoniasis. The odor is sometimes also foul or fishy, but the differences between other vaginitis is that the discharge will now become yellow, green, gray, frothy, and sticky. And there will be also itching, irritation, and inflammation, discomfortness. When we diagnose leukorrhgia, we should do differential diagnosis as all the other gynecological disease did. The first one is the intermenstrual bleeding and the metastasis versus red leukorrhea. For intermenstrual bleeding, apparently it only happened when ovulation occurs. So when we know when will be the ovulation, we expect intermenstrual bleeding. But if the bleeding or the red discharge comes out of the ovulation period, we can easy to differentiate. And metastasis has an irregular cycle, and it is usually non-stoppable. But for red leukorrhea, we are expecting regular cycle. And most importantly, the red leukorrhea is meaning the fluid is mucus instead of bloody. For intermenstrual bleeding and metastasis is blood discharge. However, when we talk about leukorrhea with blood inside the leukorrhea, the red leukorrhea is usually mucus instead of blood. Just that the mucus is red in color. And there is a great difference between uh, blood and mucus in terms of texture. The other disease we have to differentiate is the vulvar abscess and the submucosal fibroid. So vulvar abscess has redness and hot sensation in vulva because obviously there is inflammation happening and there should be painful or itchy. While submucosal fibroid can be seen under gynecological examination, such as during an endoscopy, hysteroscopy. And be very alert for the possibility of cervical, uterus, or fallopian tube cancer. Because in case of cancer, usually you have no pain at all, but there is always abnormal discharge. And so when whether there is abnormal bleeding or the leukorrhea appears abnormally in terms of the heavy amount or the color change, we should be very aware for the existence of such kind of cancer. And we can rule this out by doing test. Of course, this is not us to do the test. We have to refer to the gynecologists to do the test. Whether there is CA markers abnormally increased, or we can also even do the biopsy, do the endoscopy, and pick some tissue out and see in the lab, pathology lab, to see if there is any abnormal cells. So I saw a patient. Uh, it's actually one of my family, and she is almost 80, and she appeared to have abnormal uh, leukorrhea during this age, which is abnormal. After menopause, the leukorrhea is unlikely to happen. So when it comes out one day, it became very alerted, and she go to the doctor right away. The doctor did some examination and look into the vagina, get some cells to examine, and it ended up diagnosed as inflammation. And of course, they do this diagnosis because there is bacteria found in the biopsy, right? So they treat with antibiotics. However, it didn't work, and the Leukorrhea keep on coming out continuously. So she went to the doctor a second time, and this time they diagnosed it as a bacterial infection carrier, the vagina chronic infection of vagina. So nothing can be done, and just let it be. After half a year, she was visiting another doctor, and the doctor referred her to another gynecologist to further investigate. That gynecologist uh, do another examination on her, and it ended up diagnosed as endometrial cancer. So whether there is cancer or not, this is the very first thing we have to find out. Okay? And in your clinic, try your best to uh, miss try your best to make sure that you won't miss any cases like this. Okay? Of course, as a TCM practitioner, we have not much things to do, right? Apart from, I mean, as a TCM practitioner, we can only do the TCM stuff, but don't forget to refer if necessary. So the key point to make diagnosis of leukorrhea is the color of the leukorrhea, and also the texture and the odor. If the color of leukorrhea is dark, for example, it is yellowish, reddish, or greenish, or it is viscous texture with odor, often it points to an excessive or heat syndrome. On the other hand, if the leukorrhea appears to be pale in color, that means colorless, whitish, or a pale yellowish. And if the texture is thin, with or without odor, very often it is referring to a deficient or cold syndrome. So the first syndrome is spleen deficiency. In spleen deficiency, we have spleen deficiency symptom, such as the whitish or yellowish pale complexion, of cold limbs, tiredness, poor appetite, diarrhea, swollen ankle, and feet. The cold limbs is because spleen governs the limbs. When spleen is not function normally, we have insufficient qi and blood to warm up the limbs. And tiredness is also because of the spleen is weak. We have insufficient qi and blood to support our daily living. And spleen stomach is governing the digestion process. So when spleen is indeficient, we are expecting poor appetite. When spleen fails to transform or transport the fluid and it comes down all along the digestive tract, it will appears as diarrhea. And the water retention caused by the insufficient spleen function will also cause swollen ankle and feet. So in this case, we have water retention inside our body because spleen fails to transport the body fluid. So the tongue will appear to be a greasy coating and the pulse should be weak and relaxed. The treatment method for treating spleen deficiency symptom is to strengthen the spleen and tonify qi, as well as to lift yang and eliminate dampness. Don't forget to add the word eliminate dampness, because leukorrhea at the end of the day is dampness. So the suggested formula for treating spleen deficiency Leukorrhgia is 丸带汤. And actually, this is a very common, uh, very common formula that we used to treat leukorrhea. Or even when the excessive amount of leukorrhea is not a diagnosis, not a chief complaint, but as a symptom for other menstrual disease or gynecological disease. 丸带汤 has a whole bunch of spleen tonifying herbs, such as 白术、山药、人参、甘草、苍术. These 5 herbs serve to strengthen the spleen, tonify spleen, so as to control the leukorrhea. 白术 and 苍术 is also to eliminate dampness. We also have 柴胡, 白芍, serve to soothe liver and regulate yang qi, regulate qi, and to lift the yang qi. So 丸带汤 doesn't only works on spleen, but it also works on liver. 车前子 is a specific herb to drain dampness by promoting urination. And chopped ginger is to disperse the wind and eliminate dampness in blood level. Ginger is usually used to disperse wind as exterior herbs. But when it is in a charred form, it kind of enters the blood and to eliminate the dampness, to disperse the dampness within the blood. In case of we need to modify the formula, for example, when you also spot kidney deficiency on top of spleen deficiency, by uh, by a symptom called for example, low back pain, you can add kidney tonifying herbs such as 杜仲 and 菟丝子. If the spleen deficiency come along with the coldness causing abdominal pain, and obviously this kind of abdominal pain will get worse when cold is approaching. So here we have to warm the meridian by adding 相附艾叶. When the leukorrhgia happens for a prolonged period of time, we kind of concern the water is depleting. So in this case, we have to stop the leaking first. Here we use astringents, for example, 芡实, 金樱子, 龙骨, 乌贼骨, trying to stop the leakage in the very first place. The second syndrome will be kidney yang deficiency. For kidney yang deficiency, you will expect kidney symptoms such as soreness at lower back, and also yang deficiency symptom, for example, cold sensation at lower abdomen. Frequent nocturnal urination, always refer to kidney deficiency, and the watery stools is probably because of kidney yang deficiency. And by means of watery stools, it's more or less the same as diarrhea. So there is also it is also involving spleen as well. In this case, kidney yang serve as a foundation of the postnatal. When kidney yang is in deficiency, it will at the end affecting spleen to have yang deficiency as well. So when kidney yang the kidney yang deficiency is also causing spleen yang deficiency, the stool will appear watery. So in this case, the tongue should be pale with yellow coating, while the pulse should be deep and slow. The treatment method will be warming the kidney and to astrange the leukorrhea. The suggested formula for treating kidney yang deficiency leukorrhea is 内补丸. 内补丸 has a whole bunch of kidney yang tonifying herbs. The most effective one is 鹿茸, which is the uncalcified horn of a deer. And deer is a representative animal of yang qi. Because the deer appears to be an active and grumpy animal inland. So we use 鹿茸 to warm kidney and tonify the essence, and it coupled with 肉苁蓉 to gain the same effect. 菟丝子 also serve to tonify the liver and kidney and to secure yang 任脉. 黄芪 to tonify and to lift the qi, where lifting the qi up is essential to stop the leukorrhea from draining downward. 肉桂 附子 is a warm herb to warm kidney and tonify yang. And we have 沙元子, 白吉梨, these two herbs to warm the kidney, alleviate back pain, and to soothe the liver. And 桑飘香 here is to astrange and secure essence. In case of diarrhea, 肉苁蓉, since 肉苁蓉 has an effect, a mild laxative effect, in case of leukorrhea, in case of diarrhea, 肉苁蓉 shall be eliminated and substituted by 补骨脂 and 肉豆蔻. And if kidney is in yin deficiency, the leukorrhea should appear to be slightly viscous and odorless. It also come along with a hot sensation at vagina, dizziness, red cheek with hot flashes, fever sensation at palms, soles, and chest, which is a signature symptom of yin deficiency, and insomnia with excessive dreaming, because kidney yin deficiency is causing heart yang uprising. And there may also be constipation and yellowish urination, indicating deficient heat is accumulating. The tongue will appear to be red and with scanty coating, and the pulse will appear to be thready and rapid. The treatment principle will be tonify kidney and nourish yin, and to stop clear heat to stop leukorrhea. The suggested formula will be 治百地黄丸. We add 芡实金银子 for the strange purpose. So 治百地黄丸 simply means 六味地黄丸 added 知母黄柏. By adding these two herbs, we transform a yin tonifying 六味地黄丸 to a formula that not only nourishing yin but also to clear deficient heat. And here we added a small formula called 水陆二仙丹, 水陆二仙丹, which composed of 芡实, 金银子. 水陆二仙丹, 水 means water, and 陆 means land. Water and land. 水陆二仙丹 means two individual herbs that grows in land and in water. So 芡实 is in 芡实 and 金银子 is such kinds of herbs, and both herbs serve to astrange. The third syndrome will be damp heat. In case of damp heat, the leukorrhea will appear to be profuse, yellowish, or whitish, and sticky with odor or curd-like. So by means of curd-like, we know that is yeast infection. If dampness is accumulating within the body, we should also expect chest oppression, greasy taste within the mouth, poor appetite, because this is all pointed to the dampness inside our body. And with lower abdominal pain, indicating the spleen is being affected by the damp heat. And there is also itchiness at vagina and yellowish urination, representing the damp heat in the lower jaw. So the tongue will appear to be red and yellow greasy coating, and the pulse will be sulky and rapid. If there is only sulky, there is no heat, but if it is sulky plus rapid, heat is obviously existing. So the treatment principle will be clear heat and drain dampness. The herbal formula we use is 止带方 or 龙胆泻肝汤. In case the damp heat is locating in liver. 止带方, the Chinese word 止带方 means to stop the leukorrhea. So in Chinese form, this formula's name also already told you that the purpose using this formula. is to stop the leukorrhea. So here we use 猪苓, 茯苓, 泽泻, 车前子. These four herbs serve to drain water and eliminate dampness by promoting urination. The other group of herbs include 茵陈蒿, 黄柏, 栀子, 牡丹皮, serve to clear heat and reduce fire detoxification. And the last one, 牛膝, is guiding the rest of the herbs to go downward. So as we remember, we talked about in the previous lesson, that 牛膝 is one main herb for guidance, to guide the herbs downward, to guide the heats downward, to guide the blood downward, to guide the herbs effect downward. When the heat appears to be toxic heat, the leukorrhea will be yellowish with blood and sticky as pus and with severe odor. And we may also expecting symptoms such as lower abdominal pain, sensation, thirstiness, which points to the heat, and dizziness which worsen after evening, constipation with odor, and yellowish urination. So this is the toxic heat appearing at the lower jaw. And the tongue will appear to be red with yellow dry coating. Red tongue means there's heat, and yellow coating means also meaning the same thing. Dry coating meaning the heat is outnumbered and it causes water depletion. And the pulse should be appeared rapid. So here we clear heat and remove toxin by using 五味消毒饮. And we can add 白花蛇舌草 and 春皮, 春根白皮 and 白术. 五味消毒饮 is normally served to treat toxic heat in the upper jaw, such as having pimples, having acne all around the face region. There is toxic heat. In TCM point of view, the toxic isn't mean only the it doesn't only mean the harmful substances. When TCM talking about toxic heat, it usually refers to the heat that is resulting kind of pus or acne or the abscess forming, or at least there is a skin obvious skin lesion. So 金银花、野曲花、蒲公英、紫花地丁、紫背天葵子. These five herbs serve to clear heat and remove toxin. However, these five herbs are all of them are light in weight. So it normally serves to treat the toxic heat in the upper jaw. However, in case of leukorrhgia, the toxic heat is now in the lower part of the body. So we have to add other herbs that helps to guide the heat elimination herbs go downward. So here we use 白花蛇舌草 to not only clear the heat and remove toxin, but it also drain the dampness. By means of drain, it means going down. 春皮 or 春根百皮 is one of the main herbs to stop the leukorrhea. And it is exclusively common in Yuan dynasty, Ming dynasty, and uh, and serve as a main herb to stop leukorrhea. One of the most famous physician in Yuan Dynasty, called Zhu Danxi, uh, whenever he got a case with leukorrhea, he treated with Chunpi, and this is obviously to stop the leukorrhea. And we also add Baizhu to strengthen the spleen and drain dampness. So when we use 菊花 in 五味消毒饮, here there's a little piece of extra information about different kind of 菊花. 菊花 in English is chrysanthemum. So we have a lot of 菊花, a lot of kind of 菊花 nowadays. The most normally one is the one on the left, called it's simply called 菊花. It is slightly bigger. Sometimes it is white in color. Sometimes it is yellow in color. The second one means 胎菊 or 初菊. Tai means fetus, and Chu means teenagers. So by looking into the name of the herbs, we know that this kind of chrysanthemum is simply the younger form of chrysanthemum, immature form of chrysanthemum. This kind of taiju is believed to be more effective in terms of clearing heat and to soothe the dryness than the normal 菊花. However, we have to be very careful about what we are using in 五味消毒饮. It is kind of 野菊花. 野 means wild, and it's actually not only the wild type or the plant type difference. 野菊花 is basically another species of chrysanthemum. It appears to be smaller in size, yellow to orange color in compared to the white color in 菊花 and light yellow in taiju. And usually we can prepare some tea by using 菊花 or taiju because it's kind of sweet in flavor and good in taste. However, 菊花 appears to be a bitter taste and is not suitable to prepare the floral tea. So this piece of interesting information for you about the chrysanthemum that we use in 五味消毒饮. So this is all for the Leukorrhea part. Thank you for listening and have a good one.